Hello guys and welcome back to my channel. My name is Tommy. I'm a human nutrition student and researcher at the university, and in these type of videos what I do is to synthesize what I learned at the university during the classes. Today we're going to continue the public health series of videos and we are going to take a look at health management. So let's begin. We start with the levels of healthcare. So you have to know that there are three levels of healthcare. The primary care that ensure the highest possible level of health and well-being through health promotion and disease prevention. So prevention here. The secondary care, which is early identification of disease and prevention of the progression of any pathology found at an early stage. And then tertiary care, which is prevent worsening of the individual's health, complications or disability. This is like treatment and rehabilitation. What entities are included? In the primary one, the health centers. In the secondary, the hospitals, pediatrics, general surgery and psychiatry. In the third one, specialized health centers for rehabilitation and the tertiary health centers, such as big hospitals. Key features of the primary one: comprehensive, integrated, continuous, decentralized, accessible to everyone, programmed, longitudinal, research-based, participatory, coordinated and ongoing. The secondary one, detecting disease at an early stage and limiting the pathological damage. And the third one, long processes, high costs and high possibility of relapse, depending on the disease, of course. And then the importance in the population's health. So the primary one is important because of prevention. It lowers the incidence of diseases, acting on the pre-pathogenic state. The second one detects a possible disease within its early stages. The third one, what it does is to decrease the disease prevalence, and it also improves the quality of life of people with advanced pathological stages. Moving on, we have the community health programs. These are a set of services carried out with the aim of achieving the objectives determined in relation to the precise health problems of a given population. What does it consist of? This is basically to solve health problems and promote optimal living by the health diagnosis, the system implementation, and the results evaluation. Who carries them out? People, families, and also the healthcare services. And then we talk about sanitary models. So we have the liberal model, which is a private healthcare. The private insurance companies compete with each other. The socialist model, the healthcare financing is entirely covered by the general budget of the state. The Bismarck model, so workers pay taxes to finance social security benefits. And the Beveridge model, which is a healthcare of all the citizens through the payment of income taxes. The sources of funding in the liberal model are basically yourself. You have to pay for it, because the government makes a contribution only for the poorest people without resources. The others pay with their money. The socialist model, in its entirety by general state budget. The Bismarck model, the employee and employer contributions. Beveridge model, taxation of the entire population. Population covered, people that pay with their money indeed. But since the government also helps the other ones, it's basically everyone. Here, absolutely everyone. In the Bismarck, everyone that is or was a worker, so indeed everyone, and in the Beveridge, everyone as well. Countries that use the liberal model: United States of America, China and India. The socialist model is used in Cuba and North Korea. The Bismarck is used in Germany, Austria, France, Belgium, Luxembourg and the Netherlands. Germany was the country in which this method actually was created. And then the Beveridge in the United Kingdom, Sweden, Finland, Norway, Denmark, Italy, Spain and Portugal. The pros of the liberal method: competence. This will give scientific improvements and research to be the best one, and also the population is free to choose which healthcare system they want. In the socialist one, the government does it all for the population, boosting prevention and medicine and health. And then in the Bismarck, there is a freedom of choice, no waiting lists and the population satisfaction. In the Beveridge, we have flexibility, socialization of risk and the articulation of a fair financing system. The cons of the liberal one are the increased bureaucracy, it is profit-oriented, there is discrimination and inequity. There is no free market, and there are delayed visits. The cons of the socialist model are that citizens don't value the cost of healthcare, and also the individual freedom is limited. You cannot really choose what to do with your health. If you want a special treatment, unless your country implements it, you cannot access it. Cons of the Bismarck model, protecting the worker rather than the citizen. It does not favor organizational planning coordination between the various healthcare systems. And then cons of the Beveridge model, misallocation of resources, conflicts between public objectives, individual interests and public institutions. So basically here, it's not always fair who to treat first, since everyone can access to the healthcare system and is not well organized, as well as there are a lot of waiting lists in this method in the Beveridge model. Okay, so that's it for this video. Thank you so much for watching. I hope you understood everything I said. If you didn't, there is a comment section down below. Remember to like, subscribe and share this video to your friends and family. Download this diagram by clicking the first link in the description down below. Thank you so much for watching again, and see you in the next one. Bye!